folks, welcome back to the channel Techado, and today I'm not going to be in the picture because it's going to be one of those days when we are going to analyze, and you guys are going to know that whether we have passed the first wave or not. It's also about how to read this data. This is my third effort to let everybody understand how to read this data, and this will actually show you and give you an accurate information about what's going on with the pandemic around the world right now. So if you are not in US and if you want to compare charts and your country unfortunately is not doing a tracking and has not published tracking, you can go through this chart. It's actually made by John Hopkins University of Medicine. Now, over the past few weeks, we have been hearing that the cases are rising, and when you go out here, you'll be seeing, yeah, the cases are rising, right? So, total number of cases have rose up. So, if we just do this, you'll see that today it's up to 2.38 million. But that is total number of cases, right? So what about daily cases? So we did try to reduce the infection by May, and this period, like this whole April to beginning of June, just before of with rigorous like quarantine measures, we actually had controlled the first wave. But suddenly you will now see spikes are reaching high, and it is actually trying to cross that 35,000 or 36.4 thousand kind of marker, where we are sitting at 34.8 as of the last 3 days. But this is a broad perspective, right? We have to check something that is much more like significant. It's not about going through these charts. So let's go to critical trends, and in critical trends you are going to notice a difference at what actually the quarantine did, and what about those states that had strict quarantine rules. Now let's go to this part of the like whole chart, where we are going to see state by state. Now in New York, we know we had a lot of infection, and New York, through this whole quarantine, you will see that New York actually did an amazing job. That 10,084, the maximum amount of cases recorded in a single day. But right now, when you notice this part of the chart and what has happened during the June 21 or 22, you're going to see that their cases per day have gone down. 604, 632 new cases. Now, new cases means that these have been inspected. This does not show case fatality ratio, and we are going to come back to case fatality ratio. In that way, you're going to understand how many deaths are occurring according to in correlation with how many cases are appearing. That is also a very important trend. In that way, you will understand for yourself that whether we are being able to contain this or not. And guess what is happening with California? So California apparently has not even crossed the first wave. So what's this? May 20, April 22, 1958 cases, right? Drops down in May, 1286 new cases per day. Then they keep on, California just keeps on setting new records more or less every month. What's this? More or less every month it's setting up its new record. And today, in the past few days, you will see that it has crossed its average, and they are sitting at 6,700 or 7,000 cases per day. That is their record. California had not expected this. Now, Arizona, actually in the beginning, they were having only 185 new cases. Suddenly they got a spike in June because they had relaxed their quarantine measures, and the moment they relaxed their quarantine measures, look what happens on June 20th. Look what happens on like June 23rd, 22nd. The number of cases have gone high more than their the last case, which was the last the last maximum number of cases recorded, which was 3063. So you will see this data yourself on John Hopkins University of Medicine. You do not need to go through all that stuff. All you have to see what is the trend in your state. And I'm going to compare another state which is actually coming into highlight a lot, is Florida. Now it's very important to see Florida because apparently a lot of people are saying that this is their second wave that Florida is going through. But watch what happens. Florida starts April 2025. No, actually April 16th to 20th, Florida started their quarantine measures, and they suddenly open up on June. And they were, I think, the first few states to open up in Florida. And their governor was like, okay, so we have flattened the curve. This is where the governor was looking at. Okay, so we can open up, but watch what happens once they open up. They could have easily stretched out till like July. They could have easily stretched this to like July, and they should have been out of the first wave. But what happened was, instead they made a second spike to the first wave. And this is very disheartening, because this is some wrong, like take measures taken. I can totally understand that businesses needs to be funded, and we see everywhere we go, we see like very bad scenarios and very bad pictures about businesses getting affected. But beaches, man, like really, like like that could have been avoided, to be very honest. Now let's go to critical trends again one more time, and we will see one more very very important state as one of our case control, or the state that is doing an amazing job again apart from New York. Let's go and see Massachusetts. You will notice that Massachusetts is actually out of its first wave, to be honest, just because of rigorous quarantine, uh, by making people follow social distancing and all that stuff. And social distancing is important because of this. You will understand through the state's trends and everything. So for example, New York, you see, this has been flattened down just because of social distancing and wearing proper PPE. uh, with that said, folks, and we are going to go to something called case mortality. Alright, folks, in this, it's going to be a critical trend about mortality. Mortality means that it's a very important fact that you need to understand that in UK the mortality was 14%. Now watch this very carefully. I'm going to try to zoom in on this. So United Kingdom mortality is 14%, and if I can zoom in again, you will see that they have, that is death per 100,000 per population, while as US is sitting much more lower, where US is 5.1%. Now the reason behind, because United Kingdom and Sweden, they took a different approach. They said that, okay, we are going to just talk about hygiene. We are going to talk about and we are going to allow people be on the streets. We will not take an approach, and we are going to like develop herd immunity. But herd immunity on an RNA virus is next to impossible. Again, they did expose their population, and their mortality is 14%, even though US has got more cases. But our mortality is 5.1%, because you will notice that we are pushing aggressively PPE, and we are pushing aggressively like social distancing, which a lot of the other countries are not doing. So that's a good sign to know that like not all the time are we wrong, and we are doing everything wrong. Now before all these charts happened, I started doing this long time back, and now it's good that we already have a chart present. At that time nobody was tracking this. Even if you go back to my one of my early videos, I did a mortality rate comparison, and in my test also, or in my graph also, the mortality rate of US was actually pretty less. Now United Kingdom, Spain, and Mexico, these are sitting at a higher percentage, about 10%. The reason behind is that their elderly population is getting infected a lot, because it's a joint family kind of a system. And I've actually talked to you about this, and I told about why Italy and Spain had a sudden surge of this virus, and why they suffered a lot because of that joint family system. Now countries which are not having that sort of system is something like Canada, or countries like like United States. So United States, you'll be seeing that they are sitting at 5.1%, Brazil 4.5%, and I'm not going to consider other data, because the other data, I would say Russia is still fine, 1.4%. So 1.4% case fatality ratio is still a lot of life lost over 100,000 population. But then also it is not that alarming compared to like other diseases. But this is also due to a rigorous, as Russia took a very 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 rigorous and a very strict quarantine, posing fines, like imposing imprisonment and sentences. And this is the reason that you will see that Russia's death per 100,000 population is 1.4%, just because they had a very strict kind of approach to this whole coronavirus situation. Alrighty, folks, so this is going to be the last part. In this way, you will also understand this. If you are in the United States, you can watch this chart. Top 550 confirmed cases by county. Number one sits Los Angeles, because this wave is hitting Los Angeles very, very late. It is the same thing that happened in New York. While New York closed down and did rigorous quarantine, Los Angeles, on the other hand, has kept it open. But let's watch this. What is this spike suddenly is all about? Okay, so right now you'll be seeing that as of 20th June, there is around about 89.6k confirmed cases, which means that we are doing a good job in testing. So there's a lot of tests going on and stuff like that. But let's see the amount of death. This is very, very important, folks. So if amount of death wouldn't have gone that high, this will actually show you that the virus has actually not, and we have not exited the first wave at all. So we are still in the first wave, because number of deaths should be more than equal to number of cases trend. So the trend should be very, very similar to that of the number of cases. To do a control, we will go for New York. So New York got suppose this, so New York's thing fell down from 106 cases to all the way in 14th of in April, and it fell down. But then they again are rising in a trend position, and there's a rising trend right now with the number of cases out there also. So that trend is very critical to understand that, and you are going to understand also that whether things are going the right way or things are going the wrong way, or not. So there you go, folks. If you guys want to know more about this data, you can always visit coronavirus.jhu.edu, which is Johns Hopkins University of Medicine's tracking data, and you can go to critical trends for your state and check it out. There's a Hubei timeline, and you can read this also through the timeline and everything, and you will understand whether the world has gone through the first wave or not. So this is very critical, folks, to understand this. And PP is a must. Please maintain social distancing and everything. We all know that social distancing doesn't help a lot, because 6 feet is arbitrary. It's more 27 to 30 feet that a virus can propel, but 6 feet is under social distancing norm, because if you wear a mask, it actually restricts the flow from 27 to 6 feet. Stay safe. I would say if you're working from home, that's amazing. You're keeping probably everybody safe out there, but if you have to go outside, please do maintain these things, because as of right now, people, those who are living in Los Angeles, you see that you are in one of the most risk kind of zone, and our trends are not looking good, to be very honest. So see you guys on another episode, as this was our kind of monthly wrap up and report kind of section for the COVID-19.